Namaste and welcome to an interesting Facebook Live session. Today is Pediatric Surgeries Day and we are very honored to have with us Dr. Jimmy Shad, Senior Consultant Pediatric Urologist at Apollo Children's Hospital, Chennai, who will bring us a wealth of knowledge and extensive experience in pediatric surgeries to address all your queries and apprehensions regarding your child's health and concerns. Welcome to our Facebook Live session, Doctor.
Thank you. Thank you for keeping me here.
To begin with, Doctor, what are pediatric surgeries and what are the subspecialties?
Uh, Today is a great day, Pediatric Surgery Day, 29th of December. Every year we celebrate this day to bring more awareness for the general public to understand the importance of pediatric surgeons. I would like to take a few minutes for that. Pediatric surgeons are those surgeons who deals with the surgical conditions of a pediatric age group, which is from the day one of life to 18 years of age. So they are definitely special because they are taking care of our beloved ones. Uh, Pediatric surgery has been further subspecialized nowadays. We are almost subspecialized for each branches like pediatric cardiac surgery, pediatric thoracic surgery, pediatric gastroenterology that encompasses mostly with pediatric general surgical conditions and pediatric urology. Pediatric urology takes care of all the like for the urology constitutes of kidney, ureter, bladder, and testes and the organ of passing urine. The condition related to that. In pediatric surgical conditions, we have all take care of all the conditions like hernias. The babies may have umbilical hernias, inguinal hernias, small conditions when the testes are up that are called as undescended testes. The conditions which are babies are born with problem with the intestines. So all those conditions comes in pediatric surgical conditions. Similarly, pediatric thoracic surgeries, pediatric cardiac surgeries. So now we have expertise in each and every branch like you have in adult specialties.
Why do kids require surgery in the first place, Doctor? And what are the most common pediatric surgeries that you perform at Apollo Children's Hospital, Chennai?
It is unfortunate that some of the babies are born with congenital abnormalities. Not every child is fortunate to have a normal all the organs. We have most of the pediatric surgical conditions are congenital abnormalities. I do mostly pediatric urological conditions. So common conditions otherwise for pediatric surgical setup are like the tight foreskin, that is phimosis, or Benelopus, that is needing circumcision. Some of them will require surgery. Inguinal hernias, hydrocele, undescended testes, like the testes is not descended to the scrotal sacs or the scrotal bags. They are still on in the pathway of descent, that are ectopic testes, or hypospadias, which where when the child is not able to pass urine from the tip of the penis, is passing from the under surface of the penis. So those conditions are called hypospadias. Similar to hypospadias, they are epispadias when the urine is passing from the upper surface of the penis. There are many more complicated abnormalities like extrophies and all that. We can talk if we talk specifically, but these are the common conditions which are seen. Especially, I should not miss like the problem with the kidneys swelling, which is nowadays are diagnosed mostly antenatally, means before birth. The targets can be done between 18th and the 21st week of life.
So, why are pediatric surgeons crucial, Doctor? And what drives the need for their specialized expertise?
As I've already stressed, the importance of the age. We all love our young ones, and definitely they are specials. They are most of the times have been treated as young adults, which is not the same. Babies born, the physiology of the babies are totally different than adults. In fact, it reaches nowadays, even the talk is from even we are talking about 16 to 18 years of transition, though the studies shows even till 21 years of age, the body physiology mimics more closely with the younger kids than with the adults. So the care, the manner, the criterias, the way of doing is totally different. Definitely, I feel that you need more and more of expertise to take care of our young ones. Somebody, I won't be comfortable taking my child to somebody who sees a child once in a blue moon. And in the pediatric age group setup is, with the pediatric surgeons or the pediatricians are there taking care of the young ones day in day out. So because we are only looking at that age group, the level of expertise is different, understanding is different, the reaction, the taking care of the child is different. That's why I think you need a thing. As we know, the we are moving toward more and more specialization. Like we have all adult specialties. When you see dates back to 20, 30 years, the general surgeons were doing most of the surgical conditions. Now you have urologists, endocrinologists, cancer surgeons, you have cardiothoracic surgeons, you have thoracic surgeons. So you are, and in fact, now the time has come for disease-based specific surgeons. We're not even talking about specialties. So then, we cannot go to age-old modality when we talk about the kids. We cannot be going to general surgeons or to any other specialty. Definitely, we need specific surgeons, and the pediatric surgeons are the ones who take care of this specialty or this age group. Though even now in pediatric surgeons, we have almost moved towards specialization. Like I do most of pediatric urology. There are people who do pediatric general surgical stuff, people doing thoracic surgeries, are getting surgery. The time even have come. We are in Apollo Children's Hospital. We have a complete setup, and in fact, we are more or less motivated to do disease-specific surgeries.
More focused approach.
Yeah, definitely more focused. So definitely the expectations to give better results.
Outcomes are more
Definitely far better.
far better. So when we talk about your specialization, urology, you're very passionate about it. So can you tell us some common neurological conditions that children come to you with? And is surgery recommended for everybody, or when is it actually recommended?
The commonest condition is the tight force. So the one of the most commonest condition, but not everybody will require a surgery. Not even 5% of them will need a surgery. Phimosis, undescended testes, hernias, hypospadias, my passion areas, because that require that is part of reconstructive urologies. Then the swelling in the kidney, that is called as hydronephrosis. That can be because of ISO, that is called as PUJO. We'll talk later on. PUJO is pelvic uretary junction obstruction. Then can be even megaureter, when there is the obstruction in the ureter. That can be because of refluxing megaureter, when the urine is refluxing back from the bladder towards the ureter, that is called a VUR, vesico-ureteric reflux. Or it can be obstructed megaureter, though the refluxing megaureters are more common, close to 80%, and less is obstructive megaureter. Then is conditions called as, PUV, that is called the posterior urethral valves. There's a valve that is called as outlet obstruction, when the passage from where the urine comes out of the bladder outside the pathway, that is called as urethra. There is obstruction in the urethra, that is called as posterior urethral valves. Because these, what I am talking about, prominent conditions, because most of them needs intervention, and some of them the timing of the surgeries are very important. So as you said, like timing specifically in a undescended testes, PUVs, that we can talk later on.
We'll go condition wise,
Yeah.
doctor. Could you explain the causes and the treatment options available today for phimosis and hydrocele?
Phimosis and hydrosis are basic surgeries. Surgical, most of the times you can go for, we prefer doing hamstring surgeries, because they are the safest, and not to be driven by the media or the marketing. Going for instrument applications, I think, as I feel personally, they are little more unsafe because they are not guarded. Whereas a hand swing circumcision is the simplest. But I will like to say that not every child needs. Less than 5% of them require circumcision, and mostly, you don't try to do it at an earlier age. Those who don't get better with the medical management only end up getting surgeries when there is no other options.
So, when you meet a child, doctor, how do you ensure the safety and well being of the child during and after the surgery? if surgery is performed?
See, the most important criteria for us to safeguard a child is to, try, and if we can avoid a surgery. Surgery is always a last resort, is never a first resort in any criteria, any parameter, or any type of condition, whichever the child condition. So your understanding that why your expertise come into play, because not every radiological, as I say, not every radiological finding has to be addressed or treated or require surgery. We have only to see that which child needs surgery and who can benefit from it. Definitely, when you come to a setup like Apollo Children's Hospital, which is totally specialized setup, it is safe because you have a good the whole system is tuned to take care of the small babies. Not just surgeon is important, the staff, the expertise of even the housekeeping, the cleanliness, the sterilization, the nursing care, for phlebotomy nurses who take out blood samples and all that. You can understand how much it is difficult when we put us young ones for the even for needling. So no, you need expertise. So expertise at each and every corner we have safeness. That is good. Wards, safety all around. You have good intensive care. So the whole backing, the whole setups makes the life comfortable for us and definitely for the family.
Doctor, I'm sure you do life-changing surgeries and you do change the life of a lot of children as well. Could you share an experience with us of one of those latest challenging, life-changing child's experience?
There are plenty of them. It's very difficult to just take out one because whenever but there's a difference between the pediatric surgery in an adult. Whenever you are seeing a child, is the whole family come into picture. The family situations, the difficulties they have gone through, and they have come because we do redos. What you say, failed procedures. Babies come to us which are operated at once, twice, or sometimes 4 times, 5 times, even 8 times, 9 times also operated.
And
Child
how old was
kids.
your youngest patient?
Youngest, we operate so many kids, we operate right at birth. So it depends on the specific conditions which we present. Like postureo valve, child has to be taken as close as birth. We to take it right because we are going to benefit the child as because that is outlet obstruction. You have to give the maximum benefit to you operate right close to birth. So they have thing. But now, like for recently we did a child which is 1 month of age for kidney obstruction, that is hydronephrosis. Then we have got recently we have a child who's 5 months already been operated. We had a failed procedure done and the kidney was now poorly functioning. We had to find a way to salvage the kidney. We salvage that. Then we do a lot of hypospadias which are failed, to which we needs to recur it. So sometimes we have to plan surgeries and do 1 stage or 2 stage repairs. So there are plenty of them.
And these children lead a normal life post surgery?
Almost, see, we try to give them almost all of them close to, if they are operated a good center, most of the surgical condition are very much treatable. Definitely urological condition very much treatable. Only few of them will, those who have medical issues or renal parenchymal things, those may have some problem that needs to be addressed, but most of the surgical centers do well.
Speaking of hydronephrosis, doctor, would you be able to explain it to us as to what are the treatment options available for hydronephrosis? What is
So
hydronephrosis, firstly?
hydronephrosis is the swelling of the accumulation of the urine within the kidney. Is they not able to pass the pelvis. That is mostly the commonest condition is pelvic ureteric junction obstruction. Pelvis is the part of the drainage system of the kidney, so that is the junction between the pelvis, the part of the kidney, with the ureter, the tube that brings the urine from the kidney to the bladder. So PUJO is the commonest reason, but there are other reasons also that causing hydronephrosis in a pediatric age group. But that is the commonest nowadays with the advent of more and more antenatal diagnosis. The maternal that targets can be done between 18th week to 21st week. Most of such conditions are being diagnosed at in antenatal life. So we do a lot of counseling for the mothers. We have to time. We have try to assess what sort of conditions. So most of these hydronephrotic kidneys present close to birth. but we try to observe them. We repeat. We have made an algorithm. So for that, we try to observe. We try to see. We try to postpone as far as possible if we need postpone the intervention. Not all of them, but I can tell you here also less than 5 to 8% of them will require surgical treatment. Most of the times, the hydronephrosis seen in antenatal light resolves in postnatal follow-up. So, but some of them do need surgery, and then we are taking their modalities from minimal SS to all. It depends on the that is disease specific and patient specific. Definitely, you can do an open pyeloplasty, you can do a laparoscopic pyeloplasty, you can do a robotic pyeloplasty. It all depends on the age group and the conditions. So modalities are decided with the patient's condition in mind.
Coming to hypospadias, doctor, what is hypospadias in children, and how what are the symptoms? How does it manifest? How do people identify it?
So hypospadias is a congenital condition. You will definitely, the mothers and parents definitely come to know right at birth, because the child will not be passing urine from the tip of the penis. That is the first thing. The three aspect of it. The urine, the child will not have the meatus, the opening right at the tip. He will have somewhere on the under surface of the penis, may be close to the scrotum, the scrotal bag where the testes are there, even close to the anal opening. So there are various varieties of hypospadia. That is one aspect. Second thing, the penis will be bent. It will be bent ventrally, that is bent downwards. And the third skin, the skin that covers the cap of the penis, is not rolled all around. It will be open. The cap will be open. The skin will be only on the dorsal or the upper surface of the penis. So these three things make things. So definitely the child, it will be identified as an because it will be look different than the normal, and it identified. So it is classified into distal, mid penile, and proximal penile hypospadias. And the hypospadias, most of them, and those who are very trivial or they're glandular right at the tip, most of them need surgical intervention, and the ideal age for surgery is between 6 months to 9 months. And I like to stress upon that it should be done as early as possible, because the earlier you do, it gives us better results, because the child, because previously I think anesthesia and the understanding of the disease is getting better and better. You need to do surgeries early, because the tissues are more soft and supple and gives much better results. And the child, it is always better to operate a child before the child start getting toilet trained. So the bladder habits also come in picture when you delay the surgery for too much.
The recovery also is faster.
Recovery is faster, results are better, much more cosmetically aligned, and definitely, when the child is passing from the abnormal meatus for long, they tell a wrong perception, because urination, that is called micturition, the toilet training is a very important and complex mechanism for any child, because nobody can teach them. It is a perception. Every child has to learn on their own. What we can do, we can take the child to the toilet. You can ask him to void, but you cannot make him understand when the bladder is full, when the bladder is empty. So everything is perceived. So when the child start getting toilet training, is better that hypospadias and all this has been operated and child has settled down, because some of the hypospadias do need two-stage corrections. The two-stage, when I say some of the proximal peniles or the kids having exacerbated cordy, the bending may end up getting a two-stage repair. So that has done at least 6 to 8 months apart. So definitely you need more time for the child to settle down completely. So before the child is being toilet trained.
Do these conditions like the PUJO that you mentioned, hydronephrosis, hypospadias, kidney stones, do they take an impact on the child's mental health as well?
If not dealt properly, definitely everything will have, because kids are very sensitive. Specifically, undescended testes is very important, because it's such a simple thing. It's like a simple procedure, should be done between 6 to 9 months of age. But because the testes needs a lesser temperature for the growth, because that's why the nature has kept the testes outside the human body in the scrotal sac in all our mammals. So they need lesser temperature. When they're exposed to higher body temperature, the growth is specifically the spermatogenesis is affected. So it's such a simple thing, and it's a safe, simple surgery. It should be done between 6 to 8 months. When we delay those things, the testes start getting affected. So we definitely play that. Sometimes the kids come which is 10 years, 12 years also of age. Definitely, what I we feel there's lack of self esteem when that is when the both the testes are up and the scrotal sac are empty. Definitely, it plays with a lot of media and the knowledge awareness available today. The kids are very smart. They are also too aware. So it's always better. It works on the psyche. Plus, definitely you are affecting their fertility. So they are conscious about themselves also. That is one aspect. Specifically, hypospadias definitely is effect on their. When we see kids coming to us who have undergone repeated surgeries, they get more irritated. They're aggressive. Some of them are the other way around. Some are very depressed. They won't even talk. They won't even deny. They will not meet your eyes. So definitely, I think the pediatric will the sensitive ones. We should try to take our utmost care, and definitely the most important thing. The message today will be from my side. Definitely, for all pediatric age group problem, you should look for pediatric surgeons. That is the need for the hour.
And early identification is the key.
Early identification definitely will help them, and most of them are identified, but definitely they should reach out to the proper place. You need a pediatric surgeon for pediatric age group.
Thank you very much, Doctor. That was a very informative and insightful session. I'm sure a lot of parents, including myself, are really benefiting from this, valuable thoughts that you have shared with us. For appointments with Dr. Jimmy Shad, Senior Consultant Pediatric Urologist at Apollo Children's Hospital, Chennai, please contact 044 4040 1066. I repeat, for appointments with Dr. Jimmy Shad, Senior Consultant Pediatric Urologist at Apollo Children's Hospital, Chennai, please contact 044 4040 1066. Thank you very much, Doctor. Thank you, viewers.
Thank you.